So this is a 70-year-old female with a known diagnosis of CLL who had progression by elevated white blood count and also some anemia, and was also importantly symptomatic by her progressive splenomegaly, and therefore was presenting for discussion of treatment. Her important prognostic markers that were tested included a FISH showing a deletion of 17p and IGHV status showing unmutated. The diagnostic workup for CLL, particularly for patients who require treatment, includes prognostic markers that no longer only allow us to define how long the patient would respond to treatment or how long till they need treatment, but we're using these prognostic markers to determine the best course of action for CLL treatment. In this case, some of the markers that are critically important include the FISH test. FISH will test for deletion of 17p. I also, for patients starting treatment, check TP53 mutation status, as both TP53 mutations and deletion of 17p require a non-chemotherapy approach to their first-line treatment. The risk status for this patient would be considered high to very high because she was found to have a deletion of 17p prior to any therapy. This patient does require therapy by IWCLL treatment indications for a few reasons. First, she's symptomatic by her splenomegaly, that is, she's having left upper quadrant pain and has an enlarged spleen. The second reason that she would require treatment is that her anemia was reported as progressive, and now at 10 grams per deciliter is less than the threshold where we consider requiring treatment. There are many factors that I consider for each patient that requires treatment of their disease. Some of them are the patient's age and other organ function. Especially with chemotherapy, the creatinine and their kidney function is critically important. The other factors that you consider is just how the patient's overall health status is. The average age or the median age of CLL diagnosis is around 72, so many of these patients are older and do have other medical conditions that have to be taken into account. Even with those factors considered, there are other key factors about the CLL that we take into account, and that's why it's important that these markers are checked ahead of time. The very key ones are the presence of a TP53 dysregulation or dysfunction, and that can occur either through deletion of 17p or mutation of the TP53 gene, and that is why it's critical to test those two factors. Patients that have those really should be considered for non-standard chemoimmunotherapy approaches, and that is because there's a lot of evidence that deletion of 17p or TP53 mutation, those patients not only will not have a great response to chemotherapy, they also don't have a long duration of response, and finally there's evidence that those patients are more prone to clonal evolution or change of their disease when the chemotherapy is given.